Uh, Today, my case report is a Streptococcus sinensis, a rare agent causing native wall endocarditis in a pediatric group. This is a case report. Introduction: Streptococcus sinensis is included under viridans group of Streptococci. The viridans group of Streptococci includes alpha and non-hemolytic Streptococci, and most of them constitute the normal upper respiratory tract and gastrourinary tract microbiota. They can act as opportunistic pathogens causing serious infections such as subacute bacterial endocarditis in pre-existing native valvular diseases which are due to rheumatic heart disease, congenital heart disease, or may involve the prosthetic heart valve. The important viridin streptococci which cause endocarditis are Streptococcus mitis, sanguine, parasanguinus, oralis, pneumococci, and but accurate identification of pure species like Streptococcus sinensis became difficult because of variability in phenotypic characters in the same strain. In last few years, introduction of multitop mass spectrometry in a diagnostic microbiology laboratory has helped in accurate identification of bacterial strains, including viridin streptococcus such as Streptococcus sinensis. My case, in June 2021, a 8 years old female child with a known case of athenetic heart disease was admitted in the Department of Pediatrics at PSIC Medical College Hospital, Sanat Nagar, with complaints of intermittent fever and shortness of breath since 1 month. Fever is low grade and hot associated with chills and rigor. The baby had repeated chest infections in the past and complaints of food weight gain. There was no history of chest pain, syncope, or altered sensorium. On examination, baby was dismissed, thin built, grade 3 protein energy malnutrition was present with peripheral weakness. Clubbing was seen and showed signs of failure.
Her respiratory rate was 46 per minute, body temperature was 100 degree Fahrenheit, and her heart rate was 138 beats per minute with pansystolic murmur, heard bursts in tricuspid and mitral areas. On abdominal examination, distinction is seen with hepatomegaly. Patient was diagnosed as query infective endocarditis with congestive cardiac failure. Investigation, a 2D echo was performed, which showed severe tricuspid regurgitation with grossly prolapsed anterior tricuspid leaflet, septal tricuspid leaflet thickening, and rupture of cardia tendineae, which is possibly due to vegetative mass on anterior tricuspid leaflet. Two consecutive blood culture samples were collected in back-colored bottles were submitted to the microbiology laboratory before starting antibiotics. After then, she was started on injection ceftriaxone and injection vancomycin. The bottles were incubated at 37 degrees centigrade in the back-colored incubator. Both the bottles flagged positive within 18 hours of incubation. Arranged the broths were subcultured on 5% sheep blood agar and incubated at 37 degrees centigrade aerobically. After 48 hours, tiny green alpha hemolytic colonies appeared on blood agar plate. Catalyst test is performed and was negative. This is my blood agar plate with alpha hemolytic colonies. The isolate was kept in Vitek 2 system for identification by using IDGP card, but the report came as unidentified. It may be due to it doesn't fit into any species pattern included in the database. As the isolate was not identified by Vitek system, it is sent to matrix, that is Multitop, for identification. The strain was identified as Streptococcus sinensis through Multitop. The antibiotic susceptibility test was performed with Vitek 2 AST P68 panel, and it was susceptible to levofloxacin, tetracycline, gentamicin, ciprofloxacin, and tigecycline, and is not susceptible to benzyl penicillins, erythromycin, clindamycin, linezolid, vancomycin, and ceftriaxone and injection vancomycin infective endocarditis were reported in the world. The discovery of this novel species of Streptococcus was reported first in Hong Kong in the year 2002 by using PCR gel electrophoresis 16S RNA gene sequencing along with phenotypic methods. Streptococcus means cocci arranged in chains, and sinensis in honor of China, the place where the bacterium was discovered. Viridans Streptococcus, such as Streptococcus sinensis, are normal flora in human cavity. The pathogens is partly via the ability to adhere to hot walls via extracellular dextran, causing other infections other than endocarditis. Species level identification by phenotypic method is difficult and not accurate. The organism isolated in our sample is not susceptible to penicillins, erythromycin, clindamycin, vancomycin, and linezolid. In the past, Viridans Streptococcus were generally susceptible to penicillins, lending in antibiotics resistance with increased virulence. Antimicrobial susceptibility survey of Viridans Streptococcus has clearly shown the resistance to several antibiotics. These are my references. Thank you.
Thank you, ma'am. Ma'am, hello.